Dear colleagues, these short-acting beta-2 agonists, like salbutamol, we have different types. Our aim in all this presentation is that we need to get these medicines to the lung of the kids appropriately, to the maximum. How to reach it? This is different now. Every child is different. We have to see the child and practice on the child as well. How to use them. Dear colleague, this is the short-acting beta-2 agonist. This is what we are using nowadays, which is the pressurized MDI, meter dose inhaler. Nowadays, we are calling the Evohaler because we have changed the CFC, the propellant in them, from the CFC to the HMD. Now, this is one type, and this is the other type, which is called the Discus. Nowadays, these are the two commonest short-acting beta-2 agonists used in the market. We had in the past this Rotahaler, we had the Easyhaler in the past. Nowadays, you may find it in certain countries, but the commonest available ones in most of the countries around the world are the Evohalers and the Discus. I will show you later on how to use them separately. Very important to know the age of the child, because you cannot use this one directly as the adult they are doing it. I will show you first of all how to use it as an adult or older child, which we have trained them how to use it. First of all, what we have to do, we have to shake it and take the cap off and breathe out slowly. Then put this one in our mouth and tight it around our lips. And then press with your hand while you are taking the breath. But you have to take it slowly and keep your breath as much as you can, 10 seconds or more. This is the way we should do it. Now, what are the mistakes done with this one? Usually, you may not shake it, so the solution there, the beta-2 agonist plus the propellant and the solvent in it, they are not mixed properly. So when you are actuating and when you are pressing, you will not get the medicine properly out. So this is one. Number two, if you don't take breath out slowly and you immediately put it in your mouth, you may not be able to take the breath deeply. Number three, you should take the breath slowly in and not forcefully, because if you do it forcefully, you may induce cough with it. And now, when you are also exhaling, you are taking out the breath, you should come out also slowly and not forcefully. If you do it forcefully, you may cough and you may get most of the medicine out again. Thank you. And at the end, we need to recap it and put it back. Now, if we want to use it again, we need to wait for 30 seconds to maximum of 60 seconds so that the canister itself will get re-warmed, because once we press, the head and the tip will get cooled down and we cannot get the medicines for the second one immediately out properly. So we need to re-warm it. So we need to stay for another 30 seconds to 60 seconds and then shake it again and then do and repeat the instructions the same as before. Exhale slowly. And then recap it.